Hello, everybody. Thanks and welcome again to our podcast. Today, I have a very exciting topic. It's one that I think most every dentist deals with. The topic is how to choose between a dental implant or a root canal to save a tooth. And we have again our guest, Dr. Tao Lei. And I got to tell people a little bit insight as to why I'm so happy that you're here doing this with me. Because you did your specialty training in root canals at Harvard, so you're obviously not very smart. And then after your 3 years of learning how to do root canal specialties, you're such a geek that you said, I want to spend 2 more years doing implants. And I think you had some helpful guidance from one of my best friends, Dr. Peter Chen, who I think you know. And he said, you know what, go in there, stick around and do it. And here's kind of the unique feature to that I think is important is I don't know personally any specialists, at least here in my town, that have the unique skill set that you do. Meaning, you not only can do a root canal and save a tooth, which a lot of people that have had faced this decision, and or if the patient wants to take it out, you can take the tooth out and do an implant. And so oftentimes if you're with a specialist and that's a specialist does all the surgery, whether it be a periodontist or an oral surgeon, they can only do the implants. They can kind of only advise you on that aspect. Versus if you go to a root canal specialist that doesn't have the advanced training you do, well, they can only do the root canal. So they kind of have skin in the game. Most people I know are pretty impartial and are pretty fair, and they'll kind of recommend, even if it means not doing the surgery themselves or whatever the case may be. I don't know that people are very malicious about it. But with that being said, certainly when it comes to this topic, I think you're an excellent expert on this, because the reality is anybody watching this, sometimes people are faced. They have a tooth that for one reason or another may need a root canal. The tooth has been broken. There's not that much tooth left. And the question is, well, gee, do I put money and effort and time into doing a root canal and a post and a crown and all these other things? And versus, well, I can take the tooth out and invest a little more money usually and do an implant that's very, very predictable, and success rates are in the high 90%. So let me stop blabbing on. Please tell people brief. Let's get into sort of how you help people, guide people into the decision skills of those two big dilemmas.
I think that's a very good question. I think that's a question that a lot of dentists have nowadays.
Yep.
Do you go with the implant or do you go with trying to save the tooth and do the root canal therapy? It comes down to a number of factors. Obviously, finances is an issue too. Taking out a tooth, placing the dental implant generally is a bit more costlier than doing the root canal and placing a post and core and crown. If you look at in terms of what we could do in endodontics nowadays, for instance, if we were to look at a tooth and say the tooth had a root canal and it needed a retreatment, we could easily retreat the tooth. Or if it needed to do an apical surgery, financially speaking, if you look at the retreatment and versus an apical surgery and of an implant, it generally is more cost effective in terms of retreating it or even doing the apical surgery. For instance, if the tooth required an apical surgery, and that was a decision that obviously the patient and I we would have to discuss, the cost of that roughly around here and in our area, say roughly about $1,000 for an apical surgery, versus that of an implant, which we have to invest in the implant, the surgery, the implant placement, the post and core, the abutment for the implant and the crown, could cost you anywhere from $3,500 and above. Looking at that in that respect, the cost of an implant could be a lot costlier.
Sure.
And our apical surgeries is not what it used to be, where prognosis wasn't so great. Now that we have a better understanding and using microscopes and doing apical surgeries, doing microsurgeries, we could easily treat the infections, and the type of filling materials that we have for using the materials that we use for apical surgeries have improved significantly over the years, and our prognosis have increased to as high as 80-90% prognosis.
Wow, okay. So you're going head to head with implants almost. Implants are in the 90s, and now with newer technology with some of these root canals, you're pretty close to that.
Yeah, exactly. But if you actually look at studies comparing the two, implants versus root canal therapy, there are actually different criteria that they actually use to assess this, and different parameters. So it's very difficult to compare them side by side because it's kind of comparing apples and oranges. They're not exactly the same. But I could tell you, from my experience so far, doing implants and root canals and doing April surgeries and whatnot, there tend to be a lot more complications associated with implants after treatment. Obviously, it requires multiple surgeries, sometimes maybe bone grafting, sinus lifts, and whatnot to place an implant. But the most severe complications that I generally see has to do with the anterior region. Let's say you have a high smile line, right? Let's say you have a front tooth, needs either a root canal therapy or extraction implant. The problem that I've seen is that sometimes these teeth are taken out when they could be saved with conventional root canal therapy or even apical surgery. And the side effect of taking out that front tooth, your natural tooth, versus placing an implant is that you tend to put that tooth at risk if you say you have a high smile line. The problem is that the papilla, which is the gums in between your teeth, is very difficult to maintain with implants. And the slight discrepancy of that, let's say you smile and you see your gum line, it's very unaesthetic.
That's that typical black triangle. I mean, people hate that, and they say, "What's this black thing in my teeth?" And it's not anything black. It's the gums have receded, and now you see through the gums, and it looks like a black triangle.
Exactly. So over the years, you may have some bone loss around implants, and actually, if you look at studies, minor bone loss around implants is actually one of the successful criteria. But with natural teeth, you don't have that complication that develops these black triangles. I've had patients who come to me and say, how do we fix this? And it could be very difficult to fix, trying to, if you have a highly aesthetic smile where your gum line is showing when you're smiling. But when you compare it with implants, survival, just say the fact that you place the implant and that of a root canal, survival, if you look at the two, is relatively the same.
Wow.
It's just comparing, surgery, taking out a tooth, placing a dental implant, versus that doing a root canal therapy. Usually it's a bit more, I think it's a bit more invasive to place an implant. So, I mean, there's a number of scenarios to take into consideration, but if it was my tooth, I think I would do everything I can to try to save the tooth.
Yeah.
But when you get in the area of kind of a questionable tooth, then that's something to discuss with your dentist, and also to consider financial aspects of it too. If you want to maybe save this tooth with a questionable prognosis, or do you take out the tooth and place a dental implant?
Sure. And so just a little bit of a recap. I mean, in general, I know we're generalizing here. To do a root canal and try to save a tooth is usually less expensive, and I can vouch for that. A root canal and a crown, even if you had to do a crown, might be $2,000. I mean, nothing's cheap, but but an implant, yes, you're talking $4,000, $3,000. It certainly is more. So certainly, if finances are an issue, then a lot of times a root canal is a cheaper way of going. And then if you are on this borderline cases, just from what you were telling me, on front teeth, upper front teeth, lower smiling teeth, let's say.
Right.
You would fight harder for the root canal because, and again, I've seen this, I've lived this. Implants in the front, yes, they work, but they're tough to make look natural. Teeth look they look blockier. You lose gums, you lose bone, and that's natural for an implant. But you see it more on front teeth, and I agree with you there. Teeth look like mushrooms. They don't have that nice shape to them. They look more like triangular teeth, and so I guess if somebody's watching this video and just based on these very rudimentary criteria, if it's a front tooth, you would say fight a little harder.
If it comes to your natural tooth, I would probably, do everything I can to save the natural tooth, because if you lose that natural tooth, and let's say your implant fails, you place an implant, it fails. For you to redo an implant, every time it fails, you lose probably about a 20% chance of it succeeding a second time. Okay,
wow.
So you take out the tooth, place an implant. The implant doesn't work. Success is generally anywhere range of 90%. For you to redo that, you're looking around probably a 70% success rate.
The second time around. But that's not the case the
around.
second time around on a root canal. Let's just say you had a root canal on a front tooth. 20 years later, we classically see this as trauma. You got hit as a kid, you had to have a root canal. 20, 30 years later, that root canal is failing. The success rate is better. I assume it's not 20% less.
Right, yeah. I mean, for you to retreatment, our retreatment success rates, looking at the studies that we have, you're saying probably in the range of 80 to 90%.
Sure.
A retreatment. Apical surgery, probably within the same range.
Yeah. Still pretty good.
Still pretty good. I mean, it's certainly a treatment route that works very effectively. Unfortunately, sometimes people do come to our office and say, root canals don't work. It really depends on the quality of the treatment that's being done. Yeah, anyone could do a root canal, but if you don't do it correctly,
I cannot.
It's not going to work out, right?
Yeah, I can't. But yes, maybe somebody else. I know you can. So listen, I appreciate it. And sometimes there are those outliers. There's the cases that are just not savable, and then you have to do what you got to do. But we're kind of trying to talk about the intermediate cases where people have that selection. Hopefully somebody learns something from this and says, even if it just means asking the extra few questions to the person, say, well, what about this? Because I think you can agree, for me, the best patient is an educated patient who knows what they're talking about. They ask me the right questions. I'm like, boy, this is great, because it's so much easier for me to discuss it. And so hopefully a lot of people are watching this. I really appreciate your time, Dr. Lay, and I'm sure we're going to have you on again. I think we have another episode with just root canal, so you can get into that here at the next episode. Thank you, everybody.
All right. Well, thank you.